Hi friends, good evening and welcome to my channel Mukambika Nursing. Friends, in this video today we can see some previous questions and its answers. We will see the question one by one. First question, lithium, the drug of choice for bipolar disorder, has narrow therapeutic range of. This question was asked in AIMS Partner Exam 2015. And the options, option A, 2 milliequivalent per liter to 2.5 milliequivalent per liter. And option B, 1.1 milliequivalent per liter to 3 milliequivalent per liter. And option C, 0.6 milliequivalent per liter to 1.2 milliequivalent per liter. And option D, 1 milliequivalent per liter to 2 milliequivalent per liter. This is the question and options. Here what is the question is, what is the therapeutic range of lithium, therapeutic level. Okay, that is the question. Here answer is option C is correct answer. Therapeutic blood lithium level is 0.6 to 1.2 milliequivalent per liter. That is the normal blood lithium, therapeutic blood lithium level. And prophylactic blood lithium level is 0.6 to 1 milliequivalent per liter. And toxic level of blood lithium level is more than 2 milliequivalent per liter. Okay, this is a very important question. Therapeutic level, prophylactic level and toxic level, any one can come. That is therapeutic level is 0.6 to 1.2, prophylactic level is 0.6 to 1 and toxic level is more than 2 in blood lithium level. Okay. And this drug lithium is mainly used as a drug of choice of bipolar disorder, especially in mania. That is, in mania lithium is used in the form of lithium carbonate. So lithium is used in the form of lithium carbonate, and the lithium dose of the lithium is 900 to 1500 milligram per day. That is the therapeutic dose of lithium. So therapeutic dose, daily dose of lithium is 900 to 1500 milligram per day. Our question is, what is the therapeutic range of lithium? Lithium is 0.6 to 1.2 milliequivalent per liter. Next question, Suicide Prevention Day is celebrated on. And the options are option A, October 10, option B, September 10, option C, June 26, option D, September 21. Here question is, when is the Suicide Prevention Day? And the correct answer is option B, September 10 is celebrated as a Suicide Prevention Day. And the remaining option, October 10 is there. October 10 is celebrated as World Mental Health Day. October 10. And the color of this World Mental Health Day, the color of ribbon color is green. Green color ribbon indicate World Mental Health Day. And June 26th is there, that is celebrated as an International Day Against Drug Abuse. June 26th. And September 21, it is celebrated as a World Alzheimer's Day. Okay, so here September 10 is celebrated as Suicide Prevention Day. The next question, third question, irrational pathological fear of open place is termed as. And the options are option A, acrophobia, option B, agoraphobia, option C, algophobia, and option D, xenophobia. Our question is, irrational pathological fear of open place is termed as. So here agoraphobia is the correct answer. That is called irrational fear of open places, is called agoraphobia. And the remaining option, acrophobia, is there. That is irrational fear, pathological fear of high places, is called acrophobia. And algophobia is there. That is irrational fear of pain, is called algophobia. And another one option, xenophobia, is there. That is irrational fear of strangers is called xenophobia. So irrational fear of strangers is xenophobia. Fear of pain is algophobia, and fear of high places is acrophobia, and irrational pathological fear of open places is agoraphobia. Here option B is correct. Next question, irrational pathological fear of darkness is termed as. And the options are option A nyctophobia, option B zoophobia, option C algophobia, option D astrophobia. And here question is irrational pathological fear of darkness. Our previous question was irrational pathological fear of open places. Here darkness. It is option A nyctophobia. Nyctophobia is known as irrational fear of darkness is called nyctophobia, and that is option A is correct answer. And the remaining option zoophobia. Zoophobia means fear of animals, and algophobia, as we already saw, fear of pain, and astrophobia means irrational fear of storm, thunders, and lightning is called astrophobia. Astrophobia means fear of storm, thunder, and lightning is called astrophobia. Our question is pathological fear of darkness is called nyctophobia. And next question, fifth question, 5% dextrose in normal saline is options are option A isotonic solution, option B hypotonic solution, option C hypertonic solution, option D none of this. And here question is 5% dextrose in normal saline is an example of which solution? Is an example of hypertonic solution. 5% dextrose in normal saline is an example of hypertonic solution. Hypertonic solution means they are concentrated solutions and have higher osmolarity than body fluids. They are called hypertonic solutions. So here 5% dextrose in normal saline is an example of hypertonic solution. Some other example we can see, that is 5% dextrose in ringer lactate is an example of hypertonic solution. Same 5% dextrose in 0.45% of normal saline is also an example of hypertonic solution. And 10% dextrose in water, that is also an example of hypertonic solution. And remaining option is there isotonic solution. Isotonic solutions example we can see 0.9% sodium chloride, that is normal saline. Normal saline is an example of isotonic solution. And 5% dextrose in water, that is D5 is an example of isotonic solution. And also normal our ringer lactate, that is also an example of isotonic solution. And 5% dextrose in 0.225 saline also example of isotonic solution. And some example of hypotonic solution we can see, that is 0.45 sodium chloride, and also 0.225 sodium chloride, and 0.335 sodium chloride are some example of hypotonic solutions. Okay, hypotonic solutions, hypertonic solutions, and isotonic solutions. Next question, sixth question, 1 teaspoonful is same as. Options are option A 5 ml, option B 2 ml, option C 10 ml, option D 15 ml. And the question is 1 teaspoonful is. Here 1 teaspoonful is equal to 5 ml. Option A is correct answer, that is 1 teaspoonful. We will see the other option, that is 1 tablespoonful is equal to 15 ml. 1 tablespoonful. And some related points we can see, 1 ounce is equal to 30 ml, and 2 tablespoonful is equal to 30 ml, and also 1 teacup full is equal to 180 ml, and 1 glass full is equal to 240 ml. Okay, these are all some related points. Seventh question, which of the following natural penicillin has longest duration of action? And the options are option A benzyl penicillin G, and option B procaine penicillin G, and option C benzanthine penicillin or penidura, and option D phenoxymethyl penicillin. Here question is, which one of the following penicillin has longest duration of action? Here benzanthine penicillin. Option C, benzanthine penicillin or penidura has longest duration of or longest acting penicillin is benzanthine penicillin or penidura, and shortest acting penicillin is benzyl penicillin or penicillin G. Benzyl penicillin or penicillin G is shortest acting and longest acting is benzanthine penicillin or penidura. So option C is correct. Question. Eighth question. The drug used in the treatment of a patient suffering from H1N1 infection, that is swine flu infection, is option A ribavirin, option B oseltamivir, option C acyclovir, option D valacyclovir. Here question is, which is the drug of choice of patient with H1N1 or swine flu infection? So the main drug used for swine flu is option B oseltamivir is the correct answer. That is the drug of choice for the treatment of swine flu infection. Next question, ninth question, bacteria that thrive in high temperature, that is 55 degrees Celsius to 80 degrees Celsius, are called. Options are mesophilic bacteria, option B thermophilic bacteria, option C hyperthermophilic bacteria, and option C psychrophilic bacteria. Here question is, the bacteria which grow at the temperature of 55 degrees Celsius to 80 degrees Celsius are called. In this option B thermophilic bacteria is correct. That is, the bacteria which grow at 55 degrees Celsius to 80 degrees Celsius are called thermophilic bacteria. Normally the optimum temperature for majority of bacteria that grow is 37 degrees Celsius. So this is also an important question. Optimum temperature of majority of bacteria that grow is 37 degrees Celsius, and some bacteria grow at between 20 degrees Celsius to 50 degrees Celsius are called mesophilic bacteria. So mesophilic bacteria that grow between 20 degrees Celsius to 50 degrees Celsius, and the bacteria grow between the temperature between 55 degrees Celsius to 80 degrees Celsius are called thermophilic bacteria, and the bacteria grows below 20 degrees Celsius are called psychrophilic bacteria. In our question, the bacteria grow between the temperature of 55 degrees Celsius to 80 degrees Celsius. So option B thermophilic bacteria is correct. Next question, 10th question, disposable endotracheal tubes can be sterilized by using. Options are option A ethylene oxide, option B dry heat, option C formaldehyde, option D phenol. Our question is, disposable endotracheal tubes are sterilized by using. Option A ethylene oxide is correct answer. So this ethylene oxide is also used to sterilize disposable syringes, endoscope, cystoscope, and also various disposable items like disposable instruments, like disposable items like disposable catheters, also disposable gloves, disposable infusion set. These all are sterilized by using ethylene oxide. Here our question is, endotracheal tubes are sterilized by using ethylene oxide. Option A is correct. And we will see the next question. Next question, 11th question, total cessation of breathing is called. Options are option A apnea, option B bradycardia, option C orthopnea, option D tachypnea. And here total cessation of breathing is called apnea and normal breathing is called eupnea. Eupnea is the normal respiratory rhythm, that is eupnea. Here total cessation of breathing is called apnea. And the bradycardia means decreased heart rate, and orthopnea means breathing in upright position, that is called orthopnea. And tachypnea means increased respiratory rate, that is called tachypnea. Here total cessation of breathing is called apnea. Option A is correct. The next question, 12th question, bluish discoloration of the skin and mucous membrane is called. And the options are option A hypoxia, option B cyanosis, option C anoxemia, option D asphyxia. Question is bluish discoloration of the skin and mucous membrane is called cyanosis. Cyanosis is the bluish discoloration of the skin, and hypoxia means is a lack of oxygen in the tissue, that is called hypoxia. And anoxemia means absence of oxygen in the arterial blood, that is called anoxemia. Absence of oxygen in the bloodstream, that is called anoxemia. And asphyxia is also known as suffocation, that is lack of oxygen or excess carbon dioxide in the body is called asphyxia. Asphyxia is also known as suffocation. Here our question is bluish discoloration of the skin and mucous membrane, that is called cyanosis. Option B is correct. Next question, 13th question. Rodha's test is the test for. Options are option A albumin, option B sugar, option C acetone, option D bile salt. Here question is Rodha's test is used to detect. Rodha's test is used to detect acetone in the urine. Option C is correct answer. And the remaining options also there, albumin, sugar and bile salt. For detection of albumin in the urine, mainly two tests are doing, that is hot test and cold test. They are used to detect albumin in the urine. And for sugar in the urine, Benedict test is used to detect sugar in the urine. And for bile salt, Hayes test are used to detect bile salt in the urine. Okay, Hayes test. And another one test is there, Smith test. This is used to detect bile pigment in the urine. So here Rodha's test is for urine acetone. Next question, it's a direct question. Length of medulla oblongata is. Options are option A 45 centimeter, option B 90 centimeter, option C 25 centimeter, option C 45 millimeter. Here the length of medulla oblongata is 45 centimeter. Option A is correct answer. This is one of the direct question. Okay. Next question, total number of spinal nerves are. Options are option A 12 pairs, option B 31 pairs, option C 7 pairs and option D 33 pairs. Here total number of spinal nerves are 31 pairs and total number of cranial nerves are 12 pairs. Okay, so here correct answer is option B 31 pairs. And total number of ribs are 12 pairs and total number of intercostal muscles are 11 pairs. These are all some related points. Okay.